Picture classic pirate movie scene. Swashbuckling hero takes sword slash across arm, grins through pain.
Wraps it with dirty bandana and keeps fighting like nothing happened. Hollywood loves this image.
Of tough-as-nails pirates who laugh off injuries and keep sailing toward their next adventure. But here's brutal reality that those romantic films never show you. When real pirates got hurt. In middle of endless ocean, there were no heroic grins or quick recoveries. There was screaming. There was blood pooling on wooden decks that rolled and pitched with every wave. There were men clutching severed limbs, staring in shock at bones sticking through their skin.
Begging for help that might never come. And here's terrifying part. Most pirate ships didn't carry
Single trained doctor, no medical supplies, no painkillers, no sterile instruments or clean bandages.
When pirate crew member got sliced open by cutlass, crushed by falling mast, or shot
Through gut by musket ball, they face choice that makes modern emergency rooms look like luxury spas. They could either figure out how to save themselves using whatever scraps,
and liquids they could find on floating wooden box in middle of nowhere, or die.
Slowly and agonizingly while their shipmates watched helplessly. This is story of how desperate men turned rum into anesthesia, fire into surgical tools, and sheer willpower into medicine. Because when you're bleeding to death thousands of miles from civilization, improvisation isn't just clever, it's only thing. Standing between you and bottom of ocean. Medical situation on pirate ships was so hopeless. It bordered on comedy, if comedy could involve watching your friends die from infected cuts. While naval vessels and wealthy merchant ships employed trained surgeons who had studied at proper medical schools, pirates operated under completely different economic reality. Real doctors didn't sign up for lives of crime that involved constant danger, uncertain pay, and very real possibility of ending up decorating gibbet at nearest British port. So pirate crews had to make do with whoever was willing to play doctor, regardless of their actual medical knowledge. Sometimes this meant ships. Cook got promoted to surgeon because he was good with knives and had steady hands. From years of cutting meat. Other times it was barber, since barbers in those days actually did perform basic medical procedures like tooth pulling and bloodletting, though their experience was usually limited to customers who weren't actively bleeding to death on ship being tossed around by waves. Most desperate crews would assign medical duties to whoever seemed least likely to faint at. Someone's leg needed to come off. These improvised doctors learned their trade through trial and error, with emphasis on error part, and their patients served as unwilling test subjects in experiments. That would make modern medical ethicists weep with horror. But incredibly, some of these amateur surgeons actually got good at their jobs, developing techniques that worked despite having no formal training, and equipment that belonged in torture chamber rather than operating room. When faced with serious wounds that were bleeding heavily or showing signs of infection, pirate surgeons turned to three most readily. Available medical supplies on any pirate ship: alcohol, fire, and sharp metal abreks. Process was simple, in theory, and absolutely horrifying in practice. First, they'd pour rum directly into the wound, which served multiple purposes. It cleaned out dirt and debris, it acted as primitive antiseptic, and if they
poured enough of it down patient's throat first. It provided closest thing to anesthesia they are.
We're going to get. Then came truly medieval part. They'd heat knife blade over open flame.
Until it glowed red hot and press it directly against wound to seal it shut. Sizzling sound.
Of burning flesh, smell of cooked meat, and screams that could be heard 3 ships away.
Became routine parts of pirate medical care. For more serious injuries like mangled limbs that were.
Beyond saving, treatment was even more brutal. Amputation performed with whatever sharp tools were hand, usually.
Cutlass or carpenter's saw, followed by hot iron treatment to seal stump and prevent patient. From bleeding to death. Same rum that pirates drank to celebrate successful raids became their primary
medical supply, earning it nickname surgery juice among crews who had witnessed enough emergency operations to develop dark sense of humor about whole process. Remarkably, this crude combination of alcohol
And fire actually worked more often than you'd expect, largely because the high alcohol content in rum
really did help prevent infections, and cauterizing wounds with hot metal really did stop bleeding, even if cure was often more agonizing than original injury. But rum and hot knives weren't only
medical supplies in pirates' toolkit. These resourceful sailors learned to turn everyday ship materials into life-saving
Treatments, even when those treatments involved procedures that would make modern patients pass out just.
sea salt, which was abundant on every ship, became crucial wound treatment despite
the fact that rubbing salt into an open cut was about as pleasant as it sounds. Pirates would pack salt directly into wounds because they'd learned through painful experience that it prevented kind of festering infections that turned minor cuts into death sentences. Agony was incredible. Grown men would bite through leather straps and wooden spoons to keep from screaming, but salt really did work as
primitive antiseptic. Even more bizarrely, pirates discovered that gunpowder could be used to seal wounds.
In emergencies, they'd pour black powder directly into cut, then light it with spark, creating controlled explosion that burned wounds shut instantly. Patients who survived this treatment would joke that their wounds were loaded and ready to fire, turning their scars into conversation pieces and proof of incredible toughness. Some pirates became so skilled at gunpowder wound sealing that they could perform the procedure in under 30 seconds, though success rate depended heavily on using just right amount of powder. Too little wouldn't seal wound. Too much would blow off whatever body part they were trying to save.
These techniques sound insane by modern standards, but they developed out of pure necessity and kind.
The desperate creativity that emerges when death is only alternative to trying something that seems impossible. As pirate crews spent more time in Caribbean waters, they encountered knowledge from enslaved Africans
And indigenous peoples who had been using plant-based medicine for centuries. This cultural exchange led to
Some surprisingly effective treatments that actually worked better than European medical practices of time. Pirates learned
that certain sea mosses could be used as natural bandages that promoted healing, and that chewed.
Tobacco, when applied to wounds rather than smoked, had antiseptic properties that helped prevent infections. Aloe plants,
which grew wild on many Caribbean islands, became prized by pirate crews who discovered that gel
Inside leaves could soothe burns and help skin heal faster. Lime juice, originally carried to prevent
scurvy, turned out to be useful for cleaning wounds and providing vitamin C that helped body heal more quickly. Garlic, when crushed and applied to infected areas, actually did help kill
harmful bacteria, though patients had to endure smelling like Mediterranean kitchen for weeks afterward. Some pirate
surgeons became quite knowledgeable about herbal remedies, carrying small collections of dried plants and learning to identify useful species on whatever islands they visited. These natural treatments were often more effective than brutal alcohol and fire approach, but they required knowledge that took years to accumulate and ingredients that weren't always available in middle of ocean. Pirates who survived long enough to learn both.
Crude emergency techniques and more sophisticated herbal remedies became valuable crew members who could mean difference
Between life and death for their shipmates. When wounds required stitching, pirate surgeons faced the challenge of performing delicate needlework on patients who were conscious, in agony, and being thrown around by ocean swells that could turn steady hand into shaking mess. They used whatever materials were available, usually sailmakers' needles and coarse thread meant for repairing canvas, neither of which was designed for human flesh. Needles were thick and crude compared to modern surgical instruments, and thread was rough enough to cause additional damage as it was pulled through skin. Patients would bite down on rope, leather straps, or wooden sticks to keep from screaming and to prevent themselves from biting off
their own tongues during procedure. Person doing stitching had to brace themselves against ship's movement
while trying to sew wounded flesh that was slippery with blood and often infected. Some pirate surgeons developed techniques for timing their needlework with ship's roll, learning to make stitches during brief moments when deck was relatively stable. Finished results looked more like patches on sail than human skin. But incredibly, many of these crude stitching jobs actually held together long enough for wounds to heal, and pirates would often brag about their scars like badges of honor, comparing quality of their sailmaker stitches and telling stories about how they'd stayed conscious through entire procedure. Of course, not every pirate medical technique was based on sound reasoning or practical experience. Some
treatments were based on outdated European medical theories that were already questionable on dry land
and became downright dangerous when applied by amateurs on rolling ships. Pirates sometimes attempted to treat patients by deliberately bleeding them with leeches, following medieval belief that removing bad blood would cure various ailments. This might have made sense for treating certain conditions in controlled environment, but on ships where men were already weak from poor nutrition and hard labor, bloodletting often made patients worse rather than better. Some crews developed elaborate theories about mixing various substances into healing pastes, combinations
of soot and butter, ground bones and vinegar, or crushed insects and wine that had no medical
value but made practitioners feel like they were doing something scientific. One famous disaster involved pirate crew that tried to treat scurvy by feeding patients concentrated doses of fish oil that had gone rancid during long voyage. Instead of providing nutrition their bodies needed, spoiled oil made entire
crew violently ill and nearly led to loss of ship when too many men became too
sick to sail effectively. These medical failures served as harsh lessons about difference between treatments that
actually worked and those that just seemed like they should work, teaching pirate surgeons to stick with techniques that had proven successful, rather than experimenting with untested theories when lives were on line.
Even when pirates managed to survive their wounds and brutal treatments that followed, they still faced
ongoing challenge of dealing with chronic pain and disability an environment where showing weakness could mean death. Infection remained constant threat that could turn healed wound into life-threatening emergency weeks or months after.
Original injury. Pirates sought out opium when they could find it, trading precious cargo for small amounts
of drug that could provide temporary relief from constant agony. When opium wasn't available, some crews resorted to knocking patients unconscious with clubs or heavy objects before performing painful procedures, a technique that was more dangerous than anesthesia but sometimes only option available. Psychological toll of surviving serious injuries was just
as challenging as physical recovery, as men had to learn to function with missing limbs, permanent
disabilities or scars that served as constant reminders of their close encounters with death. Some pirates became legendary for their ability to endure pain that would incapacitate most people, building reputations for supernatural
toughness that made them valuable crew members and feared opponents. These men learned to turn their suffering
into form of psychological warfare, using their scars and disabilities as proof of their ability to
survive anything ocean could throw at them. Pain became badge of honor rather than sign of
weakness, and pirates who learned to embrace their wounds as proof of survival skills often became
most respected and feared members of their crews. As we look back across centuries at these
masters of improvised medicine, we see something remarkable emerging from all that blood and suffering. Scars that covered veteran pirates weren't just random marks left by violence and accident. They were form of
historical record, each one telling story of survival against impossible odds. Every crooked stitch mark was proof that someone had cared enough about the wounded shipmate to spend hours sewing him back together
with sail thread. Every burn scar from hot knife was evidence that someone had been willing
to endure unimaginable agony rather than give up and die.
Every missing finger or leg told a tale of quick thinking and brutal choices made in moments when seconds meant difference between life
and death. Pirates learned to read these marks like language, understanding that man covered in well-healed scars was someone who had survived multiple disasters and learned from each one. Their wounds became their credentials, proof that they possessed toughness, intelligence, and sheer stubborn refusal to die that marked difference between successful pirates and shark food. In a world where medical care meant figuring out how to save yourself with whatever materials you could scrape together, survival wasn't just about avoiding injury. It was about learning to turn pain into strength, wounds into wisdom, and scars into stories that
would echo across ages. Ocean may have tried to kill them with every storm and battle,
but pirates who learned to treat their own wounds proved that sometimes the greatest medicine isn't what
flows through your veins, but what burns in your heart. The absolute refusal to let anything, not pain, not fear, not even death itself, keep you from sailing toward whatever horizon calls your
aim. Pirates turned suffering into strength, proving that human spirit can overcome impossible medical odds through sheer determination and willingness to endure unimaginable pain rather than surrender to death. They wrote the book
on survival medicine, using nothing but rum, fire, and refusal to give up when everything seemed hopeless.
Their scars became their stories, proof that intelligence and determination can triumph over any wound, any pain, any injury that life throws at you. Ocean tried to kill them, but they
refused to die, turning every wound into wisdom and every scar into badge of ultimate survival.